Okay, well, good morning, good afternoon, and good evening, everyone. My name is Tom Hollowbone, and I am an Associate Managing Director in the Compliance Risk and Diligence Unit at Kroll, a division of Duff & Phelps. I'm delighted to welcome you to the first in a series of webinars that will offer guidance to understand how to navigate and manage the potential risks that come with producing medical devices. I'd like to welcome our two other panelists who are joining us today, Andreas Christostomou and Roland van Elst. Andreas is a managing director in our New York office and is part of the Valuation Advisory Services business unit. He is the Duff & Phelps Global Industry Leader for the Healthcare and Life Sciences Industry Group. Andreas has more than 20 years of corporate finance and valuation experience, with a focus on pharmaceutical, biotechnology, and specialty chemical industries. Andreas's clients include some of the largest pharmaceutical, biotechnology, and life science companies, as well as healthcare systems in the United States, Europe, and Asia. Roland joined Johnson & Johnson in 1987 as a medical representative for Janssen Pharmaceuticals. He held various positions in both sales and marketing, and joined the compliance organization of Johnson & Johnson in May 2005. In 2012, he became the sector lead for medical devices. Since November 2019, Roland has been the regional lead for third-party intermediary ethics and compliance for EMEA, and he is the founding member and the current president of Ethics, an international association of healthcare compliance professionals. Before we start, on the topic of Q&A, please feel free to submit questions to Andreas, Roland, or myself using the question functionality on the right-hand side of the pane, and we will spend some time at the end of the webinar answering as many questions as we can. Any questions submitted that we can't address will be answered directly afterwards. We also have a very quick 2-question survey which will pop up at the end of the webinar, so please do give us your feedback when we're finished. So today, the agenda, we will be covering a number of topics, an update on the pressures in the healthcare industry, an update on the pressures internally from Roland Johnson & Johnson, a summary on best practices, and then time for questions at the end as well. So the purpose of this webinar today is to help you understand how to navigate the potential risks that come with producing medical devices. As COVID-19 developments increase at a rapid rate globally, the concern about the lack of life-saving equipment and other essential supplies to prevent the spread of the virus and care for the sick are also rapidly increasing. More broadly, there is an urgent need for an escalation in the manufacturing of a full range of medical devices, such as face masks, ventilators, and test kits. To help meet the needs during this crisis, governments are now turning to the private sector for assistance, not just in physical manufacturing, but also for capabilities in design, procurement, assembly, testing, and shipping. With COVID-19 affecting most countries, we are witnessing a significant demand for diagnostic products that could offer accurate and early patient testing. The industry is witnessing several unique strategies to address this demand, such as reskilling current manufacturing capabilities to provide rapid tests, product distribution partnerships with unrelated stakeholders, and an evolving investment and regulatory outlook. Such developments will trigger rapid market expansion of specific products and diagnostic techniques. With this being the case, I'm going to pass over to Andreas to give us his thoughts on the risk landscape now being faced by the medical device industry. Andreas.
Thank you, Tom. And welcome everyone to the webinar. As Tom pointed out, the healthcare industry has been under significant pressure since COVID-19 came to existence. More specifically, the medical device industry have seen material impact, positive and negative at the same time. We have seen the medical device industry and companies being divided into 3 categories of products. Those COVID-19 devices like ventilators, PPEs have seen significant demand. Where on the other end of the spectrum, certain medical devices that they were a bit more optional or not essential as they've been categorized, like dental or pacemakers, orthopedics, they have seen an absolute stop into the demand and use of these products. essential medical devices, somewhere in the middle, where they were mandated because of the need to use them. Those, they have not really seen much of an impact. This high demand of products, whether it's basically for the COVID-19 related devices or the PPEs and the ventilators, have created certain needs for retooling the manufacturing, for looking into additional suppliers and rearranging their distribution channels, which of course by default it creates additional issues. At the same time, you have the manufacturing and operational side of the business, but also the economic side, and we have seen how the capital markets, they showed certain constraints over this period that impacted both individual companies, especially medical device companies, that they need additional capital to retool. If we move on to the next slide. Over here, this is a chart from Fitch, how things have changed. We have seen the COVID-19 medical devices significantly increase their demand from the period that COVID-19 came about. Over the time, it is expected that the demand is not going to continue, of course, to be like that, and we're going to have almost a negative growth in the later on 2021 after the first wave of the COVID-19 goes away. At the same time, of course, we have seen the discretionary medical devices, like as I said earlier, the dental or orthopedic, so a significant drop. They practically were put on pause. And hopefully these will start recovering in later 2020, hopefully over 2021. Time would only show. COVID-19 is a new thing for everyone and creates different uncertainty that of course has different risks. If we move to the next slide, we have seen medical device companies looking to phase the COVID-19 in different ways. We have seen them, of course, basically having to retool their own manufacturing sites and focus on producing more ventilators, more PPEs because of the high demand. At the same time, we have seen them looking out to their suppliers and new contract manufacturers for certain components. Distributing these products in this high demand is significantly important as well. At the same time, though, this comes with additional risks. If you engage quickly a new supplier for your components, if you reach out to identify a new distributor for your getting the product out in the market, or even your old sales force, given the significant capital that has been poured into the healthcare industry by the different governments, creates significant issues. This is something that we're going to basically see and discuss with Roland later on, getting into the specifics coming from a company that basically has been facing some of these issues. With this, I will basically move on back to Tom, and Tom, we can discuss later on, based on the questions, some additional things from an industry standpoint.
Excellent, thank you, Andreas. That's very interesting. If anyone has any questions for Andreas, please do submit them via the functionality on the right-hand side of your screen. But now we can move on to Roland. So Roland, from a commercial perspective, can you give us your thoughts on the current situation?
Yes, maybe highlight a little bit from the ethics and compliance point of view on what are the typical challenges in pharmaceuticals and medical devices. Typically, we are worried about labeling, sampling, safety, and other, well-regulated matters. In medical devices, there is a slightly higher risk because of the direct selling model that we have, and more entering into the complex deals with the value-based selling, which hold various parameters into one sales deal. And then, of course, you have the discounts and rebate systems that we have. We have more intermediaries in the devices business as we work with many more different suppliers and players. Safety is becoming an increasing importance, also with the European new regulations on medical devices. And then we have different kinds of transfers of value towards either the healthcare organizations or the healthcare professionals, which are typically in the center of our focus. Now, if we move to the next slide, with the COVID-19 crisis, we all of a sudden, like any other department in our organization and in industry, needed to shift gears and look at ethics and compliance in a different way. If you move to the next slide, Tom, or do I have to move that myself? Okay, right. So first of all, in the heat of the crisis, I think the first thing that changed was indeed, as you've heard from Andreas, there was a shift in use in products. So some products were barely used anymore, and others were, of course, in high demand. And from an ethical and a compliance point of view, we have seen behaviors that we would never have expected. Within the European Union, for instance, all of a sudden countries started to look at themselves again, and products that were ordered in a normal way that had to pass through a country were held at the border because the country decided that actually the product should go to them rather than to the one who ordered them in an ordinary way. So there was this really nationalistic point of view. Lasted only for a few days. Then, of course, Europe got hold of themselves, but this created already a lot of turmoil. And then we were also confronted with creative manufacturing. So all of a sudden, everybody noticed the shortage, and there was a really high tolerance towards people that came with ideas, we can make ventilators by changing some of existing equipment so that anything that would have that could blow air would become a ventilator. But of course, on the normal circumstances, you have a regulatory process that you need to go through, and then how do you do that? How is that, then what does that do to fair competition and things like that? And of course, also the authorities needed to learn that they cannot just have very strict regulations on one hand that in normal circumstances you follow very strictly, that all of a sudden you can throw overboard because there's a high need. Yet it did happen, and sometimes it was allowed. We, for instance, in the US, we produced just a simple kind of like a valve that could make it possible for one ventilator to have two patients instead of one, right? So it's not that we did not participate in this type of creativity, but of course it needs to be done with a lot of knowledge and a lot of experience, and not all manufacturers probably had the right experience in what they were manufacturing in the heat of the fight. And then you also have these intermediaries that are opportunistic, that may be just delivering your product, but then they start to play with what they have in stock. So we've seen that as well. And maybe one of the most unethical elements in there is price gouging. We've seen in many cases where there was lack of masks or hand sanitizer or ventilators, that those who were very creative all of a sudden raised their prices, and many countries have in a very short period of time issued laws against price gouging, and then before you know it, you are in violation of that new law that is issued overnight. And we have already seen a couple of cases where some of our distributors that have, of course, been not necessarily with our products, but our distributors that actually were manufacturing, or at least involved in the, or were a middleman in the mask supply, have been found or are under investigation for this price gouging. So I think as a company, as an organization, you need to be very careful and very vigilant on, not necessarily only your product supply chain, but actually all kinds of products that are subject to this response to the crisis, where your third-party intermediaries, your distributors may be involved and may be caught in either price gouging or fraud, or delivering goods that do not meet the quality standards, as I think you've all witnessed, that several companies or middlemen actually have been, and I know Germany and Belgium and other countries have all witnessed that they were receiving products that did not meet the requirements. So that may be on the negative end. On the positive end, of course, there was all of a sudden everybody had a warm heart and everybody wanted to donate all kinds of things. But also in that space, there is a lot of regulation in terms of you cannot just give away product. Normally, product is a commercial good. You need to sell it. There's competition law that comes in play. And actually, I'm also the chairman of the code committee at MedTech Europe. We needed to come together closely to look at our own code at MedTech Europe, because our code does not, of course, allow products to be given away for free. But in this case, we needed to create an exception, and then we had to do a debate about, perishable goods or one single-use products you can probably donate. But what about capital equipment? Ventilators are capital equipment. There's a high need, but as this is kind of a peak situation, what do you do with the product once you have donated it? Because the need will no longer be there, but the product with sometimes a high value may still be at the recipient end. And so we needed to look at regulation and advice, because we can't regulate that strictly, but at least we could advise the MedTech Europe members on how to donate, rather as a loan arrangement versus a pure donation in that kind of thing. We also have a lot of medical staff that wanted to volunteer, but volunteering is a benefit in kind, right? So you provide staff that the hospital would normally have to pay. So not that we can't do it, because in a situation like this, you need to act, you need to do something. But we wanted to provide some guidelines on how to do this properly, and at least also allow some deviation from our rules, because otherwise people would find themselves in violation while doing the right thing. So these were some of the challenges in the heat of the fight. Then in the next slide, then I think there will be still in crisis mode, we will start looking at or start seeing the side effects. It's not necessarily related to the disease itself, but as also Andreas already mentioned, there were a lot of products that were sold less, up to zero, where we had products that declined with 97% because all elective surgery ends. So if you have a line of products that is primarily sold in some countries, this just stopped. So then you're gonna look at the effects of overstock, right? Maybe products were meant to be sold in the next 3 months, they were close to expiry date. Then what do you do? So of course, in a normal supply chain, you may even have regulation for that, but you would never expect these numbers to be this high. Then I think we're going to be confronted with intermediaries that come under pressure, because in some cases, intermediaries buffer the accounts payable from hospitals. Hospitals are not necessarily known for paying in time because they need a government budget. So some of these things we manage through our intermediaries. Now, of course, if we would maintain the same strictness to our intermediaries while they are facing late payment from the government, that may put them in a pressure that will force them into violating rules or either bankruptcy. So you should expect as an organization that deals will be renegotiated, prices will be looked at again. And once you talk about price, what do you do in a tender situation? You're going to have to look at, can we change or can we modify some of these deals, because they may be tied to other rules like competition law. So it's going to take some time to get through these side effects. And of course, we see ad hoc legislation. So regulators have come with laws sometimes that are contradictory to what exists. And they make rules that apply for a certain period of time, and a period of time is not well defined. So that's going to lead to a lot of confusion and contradiction. And I think companies should be aware and prepared to that, and make plans on how to deal with those kind of side effects. And then I think in the longer run, if we move to the next slide, the aftermath, I think the primary discussion of this crisis will be of an economic nature, right? So what we will see in the side effects will move into a kind of like a longer term discussions. Companies will start to, how can we return products, even if they're not expired? They have overstock. And what we've seen in some markets, maybe in emerging markets a bit more, of course, than in the well-regulated markets, is that some might continue to sell goods even if they are expired, because if the return deal was not well or not in their favor, they may continue. So then you have potential liabilities over goods that are in the market, still in the sales chain, that actually should have come back to your organization. So again, as what I mentioned in the side effects is going to play not just for the next couple of months, it may play for the next couple of years in terms of accounts payable models, payment terms, and bankruptcy. So, and so there will be also an increased pressure on healthcare budgets. So I don't think we should expect the business to go to normal, and the pressure will be maybe higher on the intermediaries that you work with than if they are on your company. So, and then I think we probably need to get ready as an organization and as an industry in more of this to come, right? So some specialists were telling us this is going to happen sooner or later, but it's not. There's no certainty that this will only be happening once, right? So I think we will evolve to a different way of stock building and work on it in a more strategic way, more flexible. Also work more remotely with our customers. So the things that are also in our scope today in terms of Congress support, funding, education, I think also those things will change whether we do them directly or indirectly as a healthcare industry. So I think that kind of sums up what I wanted to say in a nutshell. And if you have more questions, then I'll be happy to answer them.
Excellent. Thank you very much, Roland. So following on from Andreas and Roland's observations, I wanted to highlight some of the areas where we see our clients being challenged and what we can do to try and help mitigate some of those risks. As I'm sure you all know, the European Union has identified 6 main typologies of corruption in the medical device industry: bribery in the medical service delivery, procurement corruption, improper marketing relations, misuse of high-level positions, undue reimbursement claims, and fraud and embezzlement of medicines and medical devices. So how do we see that manifesting itself? Well, some of the key areas where medical device sector face challenges are agents and intermediaries. So the sector, as you all know, heavily relies on third parties to access government-led healthcare procurement tenders and opportunities. 90% of the FCPA fines in the industry to date involve wrongdoing by this type of intermediary. As many scrambled to find new suppliers during and after the COVID-19 outbreak, the temptation to fast-track onboarding should be avoided. For example, the Shenzhen BioEasy biotechnology company supplied the Spanish government with substandard test kits. No due diligence was done. In fact, any due diligence would have identified concerns about the trustworthiness of the company and its products prior to being engaged. Joint venture partners are also a key risk area. Local partners are not always compliant with your code of conduct. They may operate in more permissive regulatory environments and are often less able to resist the pressures to take bribes or to take part in kickback schemes. Roland also mentioned sponsorship and charitable donations. So local charities and events sponsored by medical device firms have been at the heart of several recent regulatory investigations. As the impact of COVID-19 intensifies, more companies are making donations to charities and NGOs. It is key to ensure that you understand the background of the parties involved, ensure that they are legitimate charity, and that these do not pose a conflict of interest. We have seen several life science firms suffer serious reputational damage, when named in association with controversial NGOs. Fraud, corruption, terrorist financing, and money laundering are key risks here. And local distributors and resellers, like local partners, they pose a risk, and they are operating outside of your day-to-day oversight, and usually in countries or regions where you don't have a presence yourself. We regularly investigate situations where unscrupulous resellers and distributors apply unreasonable markups to devices and in some cases use the extra funds generated to bribe local procurement teams. And this forms the backbone of an example that I wanted to share with all of you. We were approached by a global medical devices manufacturer after they noticed that sales of a certain older models of their imaging equipment were on the rise in the Ukraine and in some parts of Russia, while dropping sharply elsewhere. Our client also noticed that sales margins for these devices in these jurisdictions were much higher than anywhere else in the world, and that, in some cases, devices considered obsolete or outdated were being sold. We conducted targeted research on our client's distributor to these jurisdictions. It turns out that this Swiss-registered entity was owned by 2 Russian businessmen. Our research found that the company was extremely successful in winning certain types of healthcare procurement tenders in Russia and Ukraine, and had been accused of profiteering, corruption, and grossly overpricing the equipment it sold to government hospitals. Additional research found that one of these companies' ultimate beneficial owners was a Russian government official in a position that could influence the outcome of public tenders. Our research also identified several complaints by Russian and Ukrainian doctors that procurement processes were corrupt, that inadequate equipment was being acquired by their hospitals, and that public funds were being wasted on overpriced equipment. Further research confirmed the existence of a kickback scheme with the Swiss distributors, using some of the funds generated by the markup on our client's equipment to pay government officials involved in procurement processes. An additional investigation within our client's organization found that some of the members of their internal sales team had been aware of and colluding with the distributor to artificially boost their sales, with one employee found to also be receiving undeclared payments from the distributor. The increase in demand for medical devices as a result of COVID-19 has seen a steady increase in opportunistic third parties and intermediaries trying to take advantage of the market, as many scramble for COVID-19 test kits and personal protective equipment. So what can be done to mitigate some of these issues? An effective anti-bribery and corruption and due diligence program. Making third parties and intermediaries aware of your policies and your expectations about how they should conduct business on your behalf sets the scene for them. Requiring them to sign and accept these policies can help to drive appropriate behavior and can also provide you with a defense should they not act appropriately. Only just over half of respondents to our anti-bribery and corruption benchmarking report reported that their programs were effective or highly effective, suggesting that there is still improvement here to make. Adequate due diligence is a key tool to ensuring that unscrupulous third parties and intermediaries are avoided. Ensuring that they are an established company capable of delivering what is promised, and ensuring that there are no historical concerns can help your company avoid unnecessary risks. Another key element is taking a risk-based approach. Understanding the risk profiles of your third parties and intermediaries will help you ensure that you focus on those that pose the biggest risk to your business. Allocating resources to ensuring those highest risk third parties do not have a history of bribery or fraud, and that they fully understand how to act, has proved effective in avoiding reputational issues down the line. Implementing and continually improving effective controls can help ensure compliance with organizational policies, provide reporting accuracy and consistency across business units, and can help document evidence of compliance or non-compliance for internal audit functions. Consistent reporting and documentation helps make identifying fraud, pricing anomalies, and exceptions like seen in our earlier example, much easier to detect. Centralization of procurement processes, like having effective controls, having an oversight of these procurement processes helps to identify anomalies and provides greater oversight. A centralized system allows for exceptions to be flagged and looked into more easily, and again makes identifying fraud or corruption much easier. In our ABC benchmarking report, amongst the reasons why third parties fail to meet ABC standards, 36% of the respondents cited unusual contract and payment structures as a point of failure. Detecting these unusual elements is harder with a decentralized process. And lastly, the tone from the top. The tone from the top setting the corporate culture cannot be underestimated. A strong culture of compliance can help reduce the pressure to commit misconduct, and encourages the reporting of misconduct, helping you to intervene earlier in the process should there be an issue. So, as we have heard from Andreas and Roland, as COVID-19 puts pressure on the global economy, companies, and all of us individually, there is an increased risk to companies. Operationally, there is a risk as they move away from their traditional product lines. Financially, from the renegotiation of contracts and potential payment issues in the supply chain. And reputationally, as the potential for unethical or illegal behavior increases. But by identifying these risks in your business and putting in place measures to mitigate those risks, you'll be in a much better place to weather the storm that we find ourselves in today. We hope that you found today's webinar informative, and we would like to move on to answer some of the questions. John, have there been any questions come through from any of the attendees that you'd like to ask the panel?
Yes, hi, thank you, Tom. So we do have a few questions, and some of them are directed towards a few specific speakers. So Andreas, the first one is for you. What do you think are the most targeted healthcare organizations by type? And I believe targeted, they mean targeted by corruption.
Thanks for the question. And definitely, let me start by saying that the healthcare industry as a whole has always been a target for fraud. Whether these are the healthcare providers, whether this is the pharmaceutical companies, the medical device companies, again, because of the significant capital that exists, it has always been subject to fraud and corruption. In regards to ranking, in essence, which companies are more affected, the ones that they have a bit less control of the whole process from beginning to end, where you do your identify the intellectual property that you have and you go through the manufacturing on your own and you distribute. If you have control of all the functions, it's a bit less likely to have potential issues. The minute though that this cycle kind of breaks and you need to introduce additional parties, definitely you give up a bit more control. And if you don't have the right measures in place, if you don't know who the partners are, if you haven't done your background checks, definitely becomes a bit of an issue. In that regard, the medical device industry itself, and of course it's in a various degree, but the medical device industry has always been almost operating as a network. You may have suppliers, you have the actual medical device company that it's in a bigger control, and then you have suppliers and distributors. In those instances where you have suppliers of certain of the components, then if you haven't done your background checks, that's where you're going to have the issues. And I think Roland and Tom, they pointed out basically clearly what they are seeing as well. On the other side, on the distribution side, definitely, at times of crisis and either because then distributors, they would like to take advantage of the situation and maybe get richer sooner. In that regard, you are seeing basically behaviors that they do provide for them to cut corners, for a lack of a better term, so they can take advantage of that, putting you as a medical device company at risk, because at the end of the day, if they are found, if they are accused, it may trickle back to you as well. So that's something that we need to have in mind. So from that perspective, if we're looking into the whole healthcare industry, medical device companies are more prone to have some of these issues. The pharmaceutical company, they're a bit more controlling. Again, it depends on the type of products as well, but there is a bit more control. Definitely on the distribution side, they face similar issues as well. And then you move into the healthcare provider side, and gosh, with all the basically funds that the governments have put in place to support them, definitely you're going to see significant fraud basically over there with either suppliers trying to kind of even sell counterfeit products just to kind of get them out in the hands of basically the hospitals and get paid. And even at the hospital level, we have seen certain times basically people putting aside some of the urgent PPEs and maybe selling them on the side. So again, it's the whole industry is at risk, and it's something that we all need to be aware of and be careful. But again, from my experience, I believe the medical device industry, the way that they usually operate, may be more prompt to these type of issues. And I don't know, Roland, if you have any kind of comments as well.
No, I think we have seen examples of what you cite in I think in all countries and with all types of intermediaries, trying to benefit wrongfully from the situation, knowing that we had in Belgium a clear case where the Ministry of Health bought actually masks that were never delivered because she did not do a background check on the intermediary, and that happened to be a two-person company that had no experience whatsoever with selling masks. They only let's say selection criteria was that they promised the minister they could deliver, right? So there's no background checks done, and of course they couldn't deliver because they believed they had the right connection, but of course the supply was already gone. So and those things became very, very clear very, very quickly, and I think we have examples in all countries where situations like that happened, where we saw how a bad background check can actually, or no background check whatsoever, leads to dramatic situations, let alone the quality of some of these masks that actually do not protect at all. So I think what we sometimes also from an ethical point forget is that we're dealing with life-threatening situations here. So imagine you send masks that do not protect at all, to the community, people believing they are protected, and then they connect or they have to work with patients that create the risk for them. I mean, that's unacceptable. So it is absolutely mandatory that also the companies that work here and those who buy do the checks well, even if it takes maybe 5 more days, but it's important to do them also, not just from a compliance process point of view, but from a pure ethical and safety point of view.
Great, thank you both. And we have another question that came in. Roland, this one is for you. How do you see Johnson & Johnson or the market in general interacting with the new EU medical device regulation?
Well, of course, it is to a certain extent a different type of discussion. And as you know, there has been a delay, or like I said, the European Commission has granted the delay in implementation of that regulation because it takes companies a lot of time to get ready for that regulation, and that's been it was a challenge altogether, and of course under the current circumstances that's even become higher. I think of course our industry and if I follow also the discussion at MedTech Europe, has a bit of mixed feelings about the regulation. On one hand, I think we welcome the regulation because it will improve the overall quality standards of those medical devices that are released into the markets. And of course, we have seen situations with various types of products, primarily implantables, that rightfully indicate that we need some more regulation. The other thing is that because of the workload that comes with it, and also the fact that it will delay introduction of products into the market. In Europe, primarily, we have usually a slightly earlier release into the market than compared to the US. So I think from a European point of view, some are concerned about that impact. But at least we, as J&J, for us, of course, we're a big organization. We can cope with that workload. And the other advantage I think we have as an organization, we have a lot of experience in our pharmaceutical arm, and as the MDR regulations bring some of the medical devices requirements closer to that pharmaceutical space for us in terms of know how to get there. I think that will be fine. And of course, let's say we are definitely in favor of all the benefits that will come out of an increased regulation. We are, of course, a bit concerned about the backlash it will give in terms of product release into the market, and on the other end, of course, while for pharmaceuticals and maybe implantable devices, the regulations are what they need to be. A walking stick is also a medical device, and you should wonder, should we have it go through the same scrutiny, of course. But we are, for us as a bigger organization, that will probably work out okay. For smaller organization, I think may be a bigger challenge. And the other challenge, of course, that was out there in the market is the notified bodies. So it's not just us as an industry, it's also that regulatory instrument that is out there that needed to get up to speed. And I think the delay in that has been now granted by the European Commission actually will help also that part of the the chain of increased regulation, new regulation get in place in time.
Thank you. So the next question we had from the audience is open to all three of you, whoever would like to answer. How do regulators ensure quality is not compromised due to high demand of PPE?
I don't know who wants to take it.
Again, I'll take basically a shot, and maybe Roland, you can provide a bit more of an insight from a company standpoint. Definitely, I think as Tom was describing the whole process earlier and some of the incidents that we have seen, even governments, hospitals, they need to do their background checks. There is a saying that at time of crisis, the bad characters are the ones that they rush to profit, right? So, with this crisis, and Roland said it earlier, even governments, they kind of broke the rules that existed to get the supplies that they needed for PPEs and other related ventilators and the like that they needed to get for their own use, right? So, where there is a break of the system, there is a need at that time to even do more background checks. Make sure that your supplier, make sure that the one that you're signing the contract can deliver, and can deliver the goods that you're ordering, not just deliver masks that they are of poor quality. I think you're more at risk in that regard for whatever is going to come after. So background checks, they are important, making sure that you know the parties, that they are known parties. These are not companies that they've been set up just basically in a matter of days to provide the supplies. And I don't know, Roland, if you would like to maybe comment as well, or Tom, by the way.
No, I fully agree. And if you look at the examples out there where, and many countries have, of course, faced the issue of being supplied with poor quality, and companies that are not usually producing these type of materials, PPEs, or all of a sudden start supplying them, that I think is a big issue. And of course, the problem is when you order, and of course, at least in countries that I'm more familiar with, these things ultimately get checked at the border, but that's way too late, right? So I fully agree with Andreas. It is better to wait for 5 days and do your checks properly and make sure that the quality that you've ordered meets the requirements, because there's also fraud in terms of do you have surgical masks or do you have the highly protective masks? And so these things are mixed, and you get documentation that will indicate it's this type of mask, but then when you look at it, it's not even close to the lower quality mask. So and we've seen all of that, and not just for 1,000 masks, for millions of masks. So there are companies out there that are not afraid to ship millions of masks that do not meet the requirements, and they just go out. And I think it is very, very important to do your checks properly rather than to get the wrong product, because you will be disappointing you know, the population more than if you don't have them. And I don't know, Tom,
Yeah.
what
Yeah, just to add to that, I think yeah, as Andreas mentioned and Roland as well, I think that it's extremely important to ensure that you understand everyone that you're dealing with in that transaction, whether it's the intermediary, whether it's the end producer, understand their track record. Can they deliver? Do they have evidence of delivering this kind of order previously? Is there any other information out there that would cause you concern dealing with them? Do they have other reputational issues? Do they have a history of bribery and corruption? All of these things need to be taken into account, and ultimately, doing these checks is essentially an investment. It's an investment in not wasting time and in not wasting money, and not falling foul of the regulatory issues that you could end up being involved in if you make bad decisions. So it's a way of protecting the company, it's a way of protecting the brand, and ensuring that you ultimately deliver what you will do to your customers as well.
Great, thank you all. So we're a little bit over time, but we received a few questions around over-reliance, so I think it's important we get to it before we close out here. The questions can be combined, I think, into this. Should manufacturers look to change reliance on one source or region?
I will start, and definitely Roland and Tom, especially Roland, probably has a bit more insight to this as well. We started seeing companies looking to identify supplies that they are more spread going forward. We have seen concentration of suppliers, especially concentration in China, and we have seen when China started facing COVID-19 and shutting down their own manufacturing, how certain either raw materials or components or products they were not properly supplied and caused significant issues elsewhere. So at least we started seeing a number of our clients reevaluating where they're going to have supply. They're going to have more than one supplier in most of the times. Again, that's best practice to begin with, but definitely we will see geographic spread of these suppliers as well. Roland?
No, I agree, and that's what I meant with the, the aftermath and the strategic look forward, right? So I think we've all seen the downside of borders being closed, authorities trying to get hold of supplies, but also, let's say, and even if the discussion on the vaccine, now we see indeed either authorities being protective and say, well, it's manufactured here, so the first client of that whatever is being manufactured is going to be this country where it's manufactured, and I think also bearing in mind that there will be other viral crises. So I think, and now the world is definitely awake, and I do anticipate indeed that that not only companies but also authorities will be looking at guaranteeing that there is access to supplies for these type of things that will be under high demand. In Belgium, the minister burned a kind of like a strategic stock a couple of years back. That's not going to happen again. So I think they will learn, and I think industry will learn together with authorities on how to manage and be ready for when this happens again.
Yeah, just to add to that, I think also if you're concerned about being over reliant on one supplier, there are companies like Kroll that can help identify others in the industry. We can conduct background checks on them and provide that as part of an assessment of possible alternatives to help diversify that and avoid that over reliance. There are options there if companies are concerned about that.
Great. Well, thank you three. And Tom, I'll hand it back to you since we're a little bit over time here.
Yeah, great, thank you. So thank you again to everyone for joining us. As I mentioned at the start, this is a series of webinars that we are hosting. The next session will be focused on supply chain risk in the medical devices sector, and that is scheduled at the moment for the end of June. So we hope you've enjoyed it. As I mentioned as well, we've got a very quick 2-question survey at the end, which will pop up at the end of the webinar once we end it. So be very keen to receive your feedback. But thank you all for joining again. We appreciate it, and hope to see you next time. Thank you very much.
Thank you.
Thank you.